It is now my pleasure to introduce our second keynote speaker, my neighbor, Dr. Joseph Rosa. Dr. Rosa III is a retired anesthesiologist and dedicated medical educator with a lifelong passion for teaching and mentoring the next generation of physicians. Born in New Jersey and raised in the San Fernando Valley, he is a proud first-generation college graduate who earned his undergraduate degree in biochemistry and cell biology from UC San Diego and his MD from USC Keck. He completed all of his clinical training at LA County Hospital here in Los Angeles. Dr. Rosa began his career in general surgery before transitioning to anesthesiology. Completing his residency at USC, where he served as chief resident, he was later invited to join the faculty, serving as co-director of operating room services and residency director for the Department of Anesthesiology and Perioperative Medicine. Now retired from clinical practice, Dr. Rosa remains deeply engaged in medical education as a volunteer professor in the Department of Medical Education and Anesthesiology at Keck. He also serves as a consultant for pre-health students at USC, offering guidance and support to those pursuing careers in medicine. Through his ongoing advocacy and teaching, Dr. Rosa is committed to sharing his experiences and supporting mental health awareness, particularly among physicians and medical trainees. Let's welcome Dr. Rosa, who will be sharing his own lived experience today.
No dark 30 one evening when I was on call. As a junior resident, there was a code blue called in room 23, which is a cardiac room. Of course, we thought it was the patient, but it was not. It was the anesthesiologist. He'd injected himself with propofol and vecuronium, which is a real attempt. That is not a cry for help. Vecuronium is a muscle relaxant. So we resuscitated him, and 6 months later, unfortunately, he took his own life. So why the white coat? The white coat represents that I'm a physician. The problem is that I hid behind this white coat for many, many years. And the other reason I'm wearing it is because I want you to know that it protects me and other doctors from nothing. We are just like everybody else. So why am I doing this? I'm doing this for the 7 anesthesiologists at UCLA over the last 30 years who committed suicide. 7 of my colleagues. So in addition to those, there are 3 personal friends that have also committed suicide. Excuse me, took their own lives. That's 10. So why am I doing this? I'm doing this for them, but there's risks associated with this. I told this story about at one of the sessions I was teaching, and the feedback from that person said I was engaging in traumatic pornography by telling my story. I confided in one of the senior residents when I was in surgery, and he laughed at me because I was afraid. What am I afraid of? I wasn't afraid of the ridicule, but it happened. There was embarrassment, accusations, and things of that sort because I was telling my story. So my problem is I have severe crippling OCD. That's what drove everything for me. It's in my DNA. So I started having these symptoms, if you will, signs, more like signs, not symptoms, when I was a kid throughout my education into medical school, but it sort of helped me, if you will. Excuse me. Those of you who are doctors will know the Starling curve of the heart means that things are good, things are good, things are good. It helps you. It helped me succeed until it did. Until I almost fell off the edge. So I did well in medical school for a bit. And as you know, many doctors here know that in medical school, you think you have every disease. They talk about, you name it, I got it. Until they move on to the next one and the next one. So for me, I had developed cold sore. So I fixated onto herpes simplex virus. I thought that was going to kill me, encephalitis, and the like. So now this OCD was becoming a problem. So now I'm symptomatic, not just signs, but symptomatic. So I thought I was going to get encephalitis and this and that. And so I was seeking care from doctors, and it didn't make any sense to anybody. They didn't understand what was wrong with me, but nobody said, you have OCD. Well, this was maybe 40 years ago. So people didn't really know much about OCD at that time. Now we know quite a bit about it and learning more. So in addition to all of these fixations and these compulsions and these symptoms, I was in medical school. So the stress of medical school on top of all of that made it very, very difficult. So I sought care. The problem was the psychiatrist that I was seeing never touched on OCD, if you can believe that. Now, this was, like I said, 40 years ago. He wanted to do psychoanalysis, put me on some medications. I was on and off. I was a terrible patient, as most physicians can be. So his diagnosis was depression, anxiety, all those kind of things. But again, the driver of all this was OCD. But somehow I managed to do well. It was very difficult. Thought I wanted to quit, couldn't take the pressure. I actually stopped going to classes for a week, and I thought I was going to be done. But support from my family and my girlfriend at the time, who's now my wife. I remember one night she said to me, "Joe, why don't you just finish? You've come so far, you may as well just finish." So I did. Somehow that connected with me. She said, "Just finish, Joe. What do you got to lose?" All right. Well, the problem for me now was in the early 80s when I was in medical school. We didn't know much about this virus that was causing death. We didn't know about HTLV3, which is what it was called. We didn't know about GRID, which is what it was called, long, long time ago. Some of you may remember that. Most people probably do not. It was 100% fatal. And we didn't know what it was. We didn't know, it was terrifying. And we took care of patients, but back then there was no PPE, there were no gloves. We just did all kinds of things unprotected. So we were exposed to these patients that were very sick, that were hyperviremic, massive viral loads. So the contamination was happening, but people really didn't understand much about it. Well, in retrospect, I realized, oh my goodness, now I know what this is. Now I know about it. I better get tested. So I got my first test, HTLV3 test, I think it's only a ELISA test. Now it's much different. And it was negative, thank goodness. So I was seeking reassurance, like testing, talking to my wife, who's soon to be my wife. But it continued, and it continued into my internship and surgical years. And during that point, it became it reached a critical point, a threshold, that I thought I was not going to be able to continue. So the symptoms waxed and waned during my internship, because I thought at the time I wanted to be a surgeon. As you'll see, I changed my mind for various different reasons. But I really tried as hard as I could. But for me, I was continually afraid, continually afraid, continually afraid. It affected my work, but no one ever suffered because of my illness. None of the patients did. So I thought I had, just like when I was in medical school, I thought I had every opportunistic infection that patients with HIV had. We operated on many, many, many patients. The patients with risk factors get sick, just like everybody else, appendicitis, gunshot wounds, all kinds of things, cancers. So we were operating again on these hyperviremic patients, and you get a nick on your hand or a needle stick, and that was terrifying. Absolutely terrifying. And I thought I was the only one that was so terrified of this. Long and short of it is that I did seek care. It was intermittent meds. Nobody came up with a diagnosis of OCD. And this was in the late 80s, I believe, I can recall. And the other thing during that time, the gang, I was on a trauma service for a bit. The gang wars were going on, if anybody can remember that. And it was devastating. Continually seeing penetrating trauma, things of that sort, not to mention the impact on society and the young kids getting shot, many of them dying. The point is I thought that everybody had HIV. Everybody. So I was terrified of everybody and operating. But nobody else seemed to deal with that the way I did. No one else seemed to be sick. So on top of all that, I was a surgical resident, working 90, 100-hour weeks easily, 36-hour shifts. It was a pyramid program. So at the time, you start with 10 interns and you graduate 5 residents. So you got cut along the way. Did not make for camaraderie amongst the group. I can tell you that. So what was I going to do? What was I going to do? The only person that I confided in was my wife. Now, the other aspect of all this is, who do I talk to about this? I'm afraid of this particular virus. I latched onto that one, like I latched on to HSV, like I latched on to lots of different things. I was never afraid of COVID, if you can believe that. It's amazing. I just latched onto that one because it was 100% fatal at the time. Thank goodness we've made tremendous strides. One of the things with OCD is that if you feed into the compulsions, it makes it worse. My wife didn't know that for years and years and years. So I would beg her for her reassurance and those kinds of things, and she did, and it made things better for a little bit until things would get worse again after a needle stick, after contamination, after all these things. So I actually was able to function around my own service. Like I said, I was on the trauma service. And I had no suicidal ideation at this point, none whatsoever, and didn't for maybe 25 years. I just went on and on and on. Never had a problem. So why did I change specialties? Because I knew that this was not something for me, in addition to the continual bloodbath that we were seeing and my fear. So I went to my chief senior resident and I said, David, I've got this problem. It was the first time I confided in anybody. And he looked at me and laughed. He looked at me and laughed. He says, yeah, those cuts in your hand, those are your AIDS cuts, he called them. I didn't know what to do. I thought it might be time to go. So I went and talked to the chief of the service, and I told him what I was afraid of. He said, real surgeons are not afraid of those kinds of things. I said, I guess I'm not a real surgeon. So I resigned after 3 years. I only had 3 more to go. So I changed to anesthesiology, which was sort of my second choice, but I really enjoyed it. I was still in the operating room, of course. I did really well as an anesthesiologist. Resident, I was chief resident. I was well respected. They called me the golden boy, which I didn't understand what that meant, but I was very successful, well liked, all those kinds of things. I didn't see it that way, but that's what they said. So I was on the faculty at UCLA, which is where I went to do my residency. And I was promoted quickly. I was very successful. I was, like Dr. Feldman said, I was chief of our, co-director of our operating room service for one of the biggest hospitals in the country. I'll tell you this, that was extraordinarily stressful. And when I was president of our HOA, that's the only thing that came close to that. I strongly recommend that you do not become part of your HOA. And Cliff will back me up on that one. Wow, that's really something. Brings out the best in people. Anyway, so I was residency director. I did all these things. I did research. I did this. People respected me. People asked me to do their anesthetics, which is the highest compliment that you can get. They always had me do many of the VIPs, which is awful, frankly. They want special care, but they don't get special care from me. They get what everybody else gets because what everybody else gets works. They think they are, but they're getting what everybody else gets. So life went on. I got married, bought a house, had my beautiful daughter, which I will show you. There's Christina. She's with me all the time. Right here, all the time. And you'll see why in a moment. But all this time that people thought I was all these things, I did not. And to this day, I still have imposter syndrome, if you're familiar with what that is. About all these things, I got this thing on the wall, that thing on the wall, this thing on the wall, but still think, is this really me? Do I deserve this? Am I good enough to do this? So there was always that good enough. Am I good enough? Am I good enough? Am I working hard enough? All these things, which is not surprising for doctors. So this whole thing became very stressful. So there was this long period of exposures, needle sticks, this, that, and the other thing, compulsions like you can't imagine, avoidance of particular things, asking patients questions that weren't quite appropriate, trying to see, did they have risk factors? What am I going to do? What's the difference? I have to take care of them. It was awful. And then, of course, there's the politics of all this, which is awful. Probably HIV has got the most politics surrounding it other than COVID than anything else, unfortunately. So up until this point into my residency, never suicidal through all of this. So why am I even talking about all this stuff? Because this sets everything up. It's also important to note that I was consumed by my work. I no longer did anything for pleasure. I abandoned my friends, family. That's all I did. I worked and I slept. I worked and I slept. So I wasn't taking care of myself. I mean, really wasn't taking care of myself. That's me in medical school. That's me towards the end of my career. So I went from 225 to 360 pounds. You would think somebody would have said something. There, that's Ronald Reagan. I don't want to pick that picture, but that was the only picture I could find all those years ago of me. You're probably wondering now, right? Reagan Library is a beautiful thing. I don't know if you've ever been there. It's really quite nice, historical. So anyway, I wasn't taking care of myself, as you can see, but nobody really said anything. Now, if you saw somebody put on 140 pounds, you think you might say something? Like, what's going on here? What you put on an entire person in weight. There's got to be something wrong. Nobody said a word. Nobody said a word. None of my colleagues. So I was physiologically and psychologically dying. I was the poster child for metabolic syndrome. And if you know what metabolic syndrome is, it is lethal. It's actually, I believe now, the #2 reason why people get a liver transplant because of this fatty infiltration of the liver. It's remarkable. #1 is alcohol. So I was well on my way. I had every sign symptom. Obstructive sleep apnea on top of all this, not sleeping, working. It was It was dangerous. It was physiologically dangerous. My health was declining rapidly. So things got much worse, if you can imagine that, but they certainly did. So the first attempt by me was what I found the first time I was a resident, a junior resident. I had everything ready to go, trying to start an IV. I had the medications, I had everything. I just reached a point where I could no longer deal with this. I was convinced that I had HIV, AIDS, all the opportunistic infections. The compulsions were too great. I would sit in the parking lot in the morning getting ready to work mentally for a couple of hours before building up the courage to go in and do it all day long again. For 25 years. Somehow, I don't know how. I just kind of pushed through it. So all this time was I getting treatment. You're thinking, Joe, did you see anybody? Did you talk to anybody? Yeah, I did. OCD was not on their list. If you can believe that, OCD was not on the list. It was in the differential, but I was being treated for anxiety, depression, and all these other things. So I was on and off meds, denial. And I don't mean the river in Egypt, but denial, very powerful, very powerful. It was a powerful defense mechanism. That and the white coat. Can't be sick, can't tell anybody. I'll lose everything if people know about me and my illness. Who would want to work with someone like me? So my office mate found me and I couldn't start an IV. Couldn't start an IV on myself. So he found me and he was shocked. He took everything away from me. He called for help. He called my wife. He called several other people that came into the room. They called my psychiatrist. The next thing I knew, I was up in the hospital being admitted on a 5150. First of two or three. I can't remember. And you'll see why I have trouble remembering in a moment. Yeah, so I couldn't wait to get the results of an HIV test. I had to have one. I had to have one. I demanded it. But I was so scared because I knew it was going to be positive. I knew that was my fate. I knew that was my fate. And I had seen, remember, all those years of people dying a miserable, terrible death. And it really was, it was gut-wrenching to see that as a physician, much like many of you during COVID, I suspect, seeing people suffer and die. There was a lot of that in my career. So I was admitted, nice hospital. I was there for a week just to be sure I was okay. They sent me home and they were going to send me into what was called a partial program for exposure response therapy. So they didn't have anything in-house for that. And they were just starting this program some years ago when this happened. I guess it was maybe 10 or so years ago, 15 years ago when my first admission. So my career is over. I knew that. Everything I worked for all those years, gone. I knew that. However, they kept my office intact, waiting for me to return for 2 years. 2 years. Never came back. Lost touch with everyone. I was ashamed. I was terrified. I was terrified of everything red. Can you imagine going through life terrified of everything red because you think it's blood and you think you're going to get HIV and you think you're going to die? Over and over and over. Day after day after day. I don't care if it was a berry on the ground that was red. One day I saw a Band-Aid. I thought, I'm not going anywhere near that. Compulsions were powerful. So they sent me home waiting for this partial program for me to get admitted, for me to begin at UCLA. I went to Arizona with my family. That's where my father-in-law lives. And he had blood on his pants one day. Absolutely decompensated. absolutely decompensated. It was awful. I returned home. I was completely isolated from everyone. And I was in this partial program, but I wasn't ready. I couldn't tolerate. I was so sick that I couldn't even tolerate the therapy. So after a couple days, I was admitted again on a 5150 because I was screaming, I'm going to kill myself. And I certainly thought I would. I guess I convinced enough people, so I was escorted by UCPD over to the hospital, to the ER where I knew everyone. Again, I didn't care. Here's this guy that we all knew for 25 years who was an anesthesiologist and this and that. Everybody knew me. Didn't matter. I was focused on trying to kill myself because I could no longer stand the pain. The only way out was the pain. The only way to stop the pain was to stop living. That's what I thought. And therapy meant I was going to keep having to live with this pain. So I'm kind of putting myself in a situation that I knew was going to continue to cause me great pain. And the reason I wanted to die. I'll never forget that day. They and I tell you, I think everybody did everything they could to help me. I think they did their very best to help me, but it's very difficult to deal with, one, a patient like me, number two, a professor that they all knew. You certainly don't want to do anything bad to a professor. It looks pretty bad. So I was admitted again on a 5150. I was in the ER. They wouldn't give me any medications. It was quite humiliating when I had these periods of lucency where I thought, oh my gosh, what have I done? I didn't care. I just wanted to die. And I kept saying that over and over. They admitted me again. Med changes. There was no inpatient treatment for OCD, so it was just medication, which doesn't treat anything. It's a Band-Aid on a gunshot wound to the abdomen. It's meaningless. But I was heavily medicated with all kinds of medications. And that was really not a good thing. I wasn't getting the appropriate treatment because I was really too sick. So I started seeing a psychotherapist who specialized in OCD therapy. And she saved my life. There was no doubt in my mind. She saved my life. Oh, by the way, I didn't show you. I lost some weight. That's when I got better. I'll tell you about that in a minute. So, but I want to go back and there's mine. Oops. There we go. There's my daughter. She's with me all the time, and I want her to be with me here. And you'll see why in a moment. So Denise started to see me, but she told me as well, we've got to get you well enough to participate in exposure response therapy. I don't know if you know what that's like, but it's sit in the room with snakes and you're deathly afraid of snakes. You face your fears. For me, it was things red. We did this very elaborate things, places I went, touched things, shook people's hands. We did all of these things, but not until I was appropriately treated. So that's kind of coming up in the wellness part of this. So many things happened. I decompensated again. I was admitted for the third time. Now, don't forget, I'm at home. I'm not working. I'm just trying to survive with this. I completely isolated myself. I was profoundly symptomatic with depression, nearly catatonic, I was told, because I didn't do anything at all. Meanwhile, my daughter is getting older, and I'm missing things and missing things and missing things. I forgot a lot of things, and I'll tell you why that is the case in a moment. So that third admission, I was in for 3 months. And it was sort of a voluntary admission. That one was a little more difficult because of the environment I was in and the way they treated me, because I was so sick. I became violent at times. They threatened 4-point leather restraints, in fact, which I would understand now in retrospect why. I'm a pretty big guy, and I was pretty angry, and I was lashing out. So it was pretty bad. But now I'm in the hospital, and there's no treatment for OCD. There's no therapy for OCD in-house. They're just warehousing me, if you will. So bottom line is I had medication-resistant depression. I was on all kinds of medications. You name it, I was on it. So what's left? For medication, a person with medication-resistant depression, there's only one thing left, and that's ECT. I'll get to that in a moment. Now, I knew ECT well because I spent so much time helping setting up the anesthesia side of the service, and I had done hundreds of them, and it is amazing to me how it works. That's my opinion. That's anecdotal, but I saw it for years and years and years and years. I know the controversy behind that, all those kinds of things. What people think of when they hear ECT is one flew over the cuckoo's nest, right? We all saw that. It's nothing like that. It's nothing like that at all. So it was difficult to see the service, the nurses that were there, the doctors that were there, that I had worked for years and years and years. And in fact, the anesthesiologist who was taking care of me for this was a resident I had trained. And I had spoken to him years later and says, Joe, you used to ask me not to wake you up. I thought, my gosh, I can't imagine somebody saying that to me as an anesthesiologist. So anyway, the ECT is not without its problems. So for me, I had 36 treatments. Somewhere around 12, 13, 14, I think I don't even know what the average is, but that's far beyond that. So it started to work. It started to work. The suicidal ideation subsided. I started to sort of come out of this shell. They were happy. I was happy. At least they thought I was, because I guess I'd smiled. It was the first time I'd done that in quite a while. So I'm in this very difficult place to be in a hospital, for 3 months. So the side effects of ECT was for me, it was profound memory loss. Profound memory loss. Short-term, intermediate, immediate, long-term, cognitive dysfunction, significant cognitive dysfunction. I've had several neuropsych tests that showed that I was really impaired. You can't tell usually when I'm talking, but the memory is how most people tell, because I forget things. And sometimes have trouble keeping my train of thought, and et cetera, et cetera, et cetera. Okay. So I was admitted again. And they found that I was having significant heart problems from all the disease, for all the drugs. Long and short of it is, they sent me home after that was all straightened out. And I hit rock bottom when I told my daughter that Daddy was leaving, because that very day I was trying to get a gun to kill myself. But I was never admitted again after that. Found a new psychiatrist. They put me on the appropriate medications, or medications that were working. The participation in the exposure response therapy worked, although there were ups and downs, exposures, or at least near exposures, or I thought there were exposures over the years, but things were starting to improve. But it took many, many years, maybe 5 or 6, for me to get out of that shell I was in and that fear. So the recovery. Recovery was all of that therapy. But what really did it is somebody invited me to a retirement party for the one person at UCLA, and I went to that party, and the outpouring, some people hadn't seen me for 6 or 7 years, and the outpouring of love at that party was unbelievable. And that's really what got me going. I reconnected with people. I started doing things, my cactus garden, all those other things. And the big break was allowing me to start teaching again at UCLA. I was there about 5 years. I threw my heart into it. But for some reason, I remember the medicine. I remember the medicine. Thank goodness, because that's really what saved me. I came over to USC after a few years for various reasons, which is my alma mater for medical school. And I teach Introduction to Clinical Medicine here for the first and second years. I teach anesthesiology to the third and fourth years. I do a lot of different things there. I mentor the students at USC that are pre-meds to do what I love. So I loved medicine so much, and that's sort of what pulled me out of this terrible situation, in addition to all the therapy, in addition to the medications and all of this, but this sort of gave me purpose again. And so I found my purpose. I don't know if any of you have read Viktor Frankl's book, Man's Search for Meaning, but I did. I found it. I was given a second chance at life. And very, very few people get that. And very, very few people become well enough to find their purpose. And I am extraordinarily grateful that I found that. And as far as medicine goes, Sir William Osler said, to teach, to prevent disease and to relieve suffering, to heal the sick, this is our work. And that's what I found was my purpose. To heal and to teach people to heal. That's what I do. That's what I do. The other thing that keeps me going is volunteerism. A lot of it. I give a tremendous amount of my time, but I love doing it. I felt I had to do this. I had to give back to the people that trained, that I was trained. I had to do these kinds of things for other people. So let me just show you real quick. I know I have to wrap up, but one day I was in Arizona and I saw Teddy Two Stumps. He had a sign that says, "I need new legs." And I was compelled to help him. Compelled to help him. He needed new legs. So that's what we did. We got him new legs. He needed a little bit more money to get new legs. He's a vet. He's also a vet. He's also a vet. I was so happy to help him. Didn't take much. Didn't take much at all. There he is, standing up. There's me with him. That's another person I helped. I'll tell you about that in a minute. So the reason I'm showing you all this is I challenge everyone here to help people. Not talk about it, not do anything about it. You have to do something about it. There's a song by Elvis Presley that says, a little less talk, a little more action. You may have heard that song. And I think that is, for me, that helped me tremendously. And the volunteerism and all the work that I do now, I love what I do. And it gives me that purpose. And it gives me the strength to keep going. So I'd like to thank all of you for listening to me. And there's Brenda. Thanks.
Dr. Rosa, please tell us your daughter is alive and well.
Oh, yes, yes. Oh, my gosh. She's alive and well. Oh, my gosh. Did I give you guys the impression that she wasn't? Did I really? Oh, my gosh. No, she's alive and well. She's 27 years old at UCSB, getting her PhD in clinical psychology.
We'll take some questions.
Oh, sure.
We'll take some questions.
Sure. Yeah. Mm-hmm. That's one of my other passions. And I'm so proud of it, and I wanted to share it with everyone. And the other thing is cactus are incredibly resilient. They're incredibly resilient. And I think somehow, some way, I was resilient. Somehow. So that kind of represents that. Plus, it's kind of cool, huh? It's pretty neat. I love that.
Before we take a
Yep.
question, I have a couple of comments online. Thank you for a powerful story and the bravery it took to share it. Dr. Rosa, thank you for sharing your remarkable story with us. Thank you for clarifying that your daughter is
Oh my
alive.
gosh.
Really not a question. I just wanted to say I'm glad that you're still here.
Thank you.
And you were able to share the story with us.
Glad to be here.
And thank you so much for sharing your story. As an anesthesiologist who had really intractable depression, OCD, the struggles that you went through, suicidality, did you at any point or have you since come across ketamine infusion therapy, considering ketamine is an anesthetic, really is one of the fastest acting, safest treatments for treatment refractory depression and suicidality available today?
Yeah, I don't know a lot about it. I have read about it. I've never seen a patient who has been treated with it, but I am hopeful that it is. It will certainly be another tool that we can use to rescue people that are in desperate straits. For me, it was ECT. They did not have that 12 years ago, whatever it was.
Thanks so much.
Sure.
Dr. Rosa.
Yes.
Thank you so much for sharing. And it's an honor to be here with you.
Thank you.
One of my questions is, at any time, because as a clinical hypnotherapist, I work with OCD and behavioral and habit. Did you use hypnosis or hypnotherapy at any time?
I did not. They didn't think I would be a good candidate for it. And I think one of the things they told me is that I just, with the cognitive dysfunction, with the suicidality, they just, again, I don't know, and I don't know a lot about it, but they didn't think that would work for me, at least at that stage. Mm-hmm.
Okay, Dr. Rosa, thank you.
Thank you very much. And please feel free to send me an email, and I'd love to hear from any of you about what I said, what I did, and if you have any other questions. Thanks very much.
Thank you.
Mm-hmm.
So I'd like to thank Dr. Rosa for his talk. I would also like to say, in that initial film, I saw some things in your house that I don't think were approved by the HOA, actually. Never mind. I don't think you heard me. If you're interested, at Wake Research in Encino, we had a ketamine trial. Actually, it was a psilocybin trial for treatment-resistant depression, and we are going to get a ketamine trial for PTSD. If you're interested in these things, you could speak to Michael at the Wake Research table right outside. But for now, we're going to take a brief break. So go out and stretch your legs, and we'll be back in 10 minutes.